And good afternoon and welcome to Straight Talk. This is Catherine Tyson, your host. And welcome. This is a medical Monday. God, it feels, I don't know why it doesn't feel like a Monday today. I must have had the longest weekend in history. It was my daughter's birthday, so I want to shout out to her. Happy birthday, happy belated birthday to Caitlin Tyson, my baby. She's a big baby, but had an awesome weekend, and of course, everybody had to like rally up and just be involved with all. You know why? Because last year was COVID. That was her birthday. So imagine she was like, no one tells me no about anything that I have planned this year because last year my mother gathered up some fruit and dusted off some items that didn't even have tags on them anymore and went to her door and left them there. That was the situation last year, right? So, happy birthday to Miss Caitlin, and of course, many, wishes for 100 more years as we share that time on this earth together with nothing but joy. So welcome to the show. And thank you so much for joining me this afternoon. Of course, 9433700. Always, we have an open line. Love to hear from you. It is hot this week. This is a hot week, sizzling. And my goodness, and the voice you just heard was Shamari Scott, who is the Chief Business Officer at Health City. On Monday, with Medical Mondays, and it's brought to you by Health City. So good afternoon, Shamari. Welcome to the show.
Good afternoon. And I thought, it seemed like Christmas was Wednesday is coming up. Why, it doesn't feel like a Monday, but
I don't know.
They will do that.
Well,
it was also my little one's birthday,
really?
April 7th.
Okay.
April 7th. So he had his third birthday.
Okay. I remember 3 actually.
Yeah.
I have her on a video saying I'm 3 years old.
3
years old. I'm 3 years old. So I remember that birthday.
My own, he doesn't say free, but he'll say excavator.
Okay.
Yeah. Talks about excavator, dump truck, and mixing truck.
Wow.
And,
Excuse me.
But everything else, even mom and dad, excavator.
He knows that. Okay. I see an excavator owner or operator in the future.
Well, it's something.
Yeah.
But the interesting thing as well is that Matthias, my oldest, so he just turned 11 in March.
Okay.
And, I called him Big Man. And he's like, yeah, that's what you should call me. You need to talk to mommy. I'm like, what? She keeps calling me baby. And I'm like, because, and then he finished my sentence, I will always be her baby. And
Always.
I'm like, yes, always.
Always. Hello.
Doesn't matter.
Hello. Yeah, that's never going to change. I'm sorry. Matthias, it is? I'm sorry. Shamari is somebody's baby.
That's right.
The Scots consider that, that's
Sure.
just how it goes.
So my apologies for not being here many Mondays because I was doing the chamber debate forum. So we had to get prepared prior to going into the night. So, but I'm sure, Tiffany and everybody else did a great job.
They held it down. They held it down. The only thing with having Tiffany, because I love Tiffany and I go way back from the Chamber of Commerce days before she actually moved, I think, she was at, she was at teacher, and then she went over to Health City.
She left me from DOT.
No, didn't know that.
Yes.
She did mention that.
Research
In banking.
That was
So it was really nice having her. But the only difference is, let me tell you, is that she's going to deliver a message, and if you ask her a question that's kind of not, it throws her off, she's looking at you like, stop asking me So I got kind of, I said, that's not Shamari. Shamari, let me tell you something. You guys hear me joking with Shamari? I'm like, thinking that he can operate on somebody soon because you were just like that paying attention person that's just like, I'm jumping
been running long enough. So,
exactly. So, and they had you quite busy with the chamber.
Yes.
Exciting. Wednesday's coming up.
Yeah, Wednesday's coming up.
How was that? So that was a whole month, wasn't it?
Yeah, we had 19 different chamber debates. So every constituency, right? tag your it.
Okay.
Right? That I sit and be a
All
part of. But
right.
it was a great experience. I would have been listening anyway, but
Yeah.
to actually sit there and the conversations in between breaks, I think was the actual best part of me being there.
Yeah.
And there was a lot of gamesmanship going on. So, coming from the basketball world, you wouldn't think in a debate you would have trash
Oh,
talking
come on.
in between,
Really?
and there was some good intimidation tactics and trash
So
talking that was
funny.
going on. That was really funny
Yeah.
in between.
Oh, interesting. Yeah. So the part that you see, yeah, yeah.
So some candidates were flustered coming out of the breaks, and you wondered why.
Why?
Yeah.
It wasn't
Some,
like we were just drinking water.
no, so they're getting trash talked, and
Did you guys have to calm them? Were you kind of like referees at all?
No. I mean, it was all good fun.
No. Okay.
And they were all, everybody was cordial, and I'm sure everybody respects each other. So
All
at the
right.
end of the day, I always remember a politician once saying to me when I was much younger, um, he was giving his outline in regards to his policy, and he took a stance on a position that was contrary to what he had done previously. And I said, well, why would you do that?
Okay.
He's like, because it's politics, and now he got to take his licks straight. But at the end of the day, what separates us is personalities. And yes, we all have the same goal, just different ways to get there.
Right.
But anybody who brings themselves forth
Yeah.
to go through this process is a special kind of
Oh,
person.
you bet.
And we all have respect for each other, even though it may not seem like it when you have that gamesmanship going on
We
in the
definitely
political
should.
arena.
Yeah.
But yeah, so yeah,
I think
everybody,
we have to have respect for each other. We really have to be willing to work together.
definitely.
Because when the decision has been made at the end of the day, because I was in the 2017 elections, right? And so at the end of the day, when the decision was made on midnight, and we knew I had to work with them for 4 years. It's still my country, right?
That's
So regardless of whatever it is, even putting yourself forward for something, when you realize that this is for the next 4 years, these are people that are running the country, like it or not.
Mhm.
And you can feel a little hurt, and you can feel disappointed, but you got to get over that quickly because we're not kids, we're grown-ups, And I think that to me was such a great lesson. It really was. And I came out of it respecting people regardless of whether I would vote for them or not.
Right.
You know what I mean? And just respecting that somebody could be a lovely person, but does not necessarily need to be a leader of my country.
Right.
And so, because I mean, it doesn't, just because I know you, and I think that's what's very important for me too this time around is that people kind of make those decisions, not because you like the person or because your mama voted for them or because, even they give you something, it does not necessarily mean that they should lead your country. However, in the event that they end up in that spot, that you just know, all right, I'm going to have to work with this person for the next 4 years because our country deserves us to have all hands on deck.
Definitely. And regardless, you pray for them to be successful because their success is the country's success.
Absolutely, exactly. Because my opponent at the time, becoming successful, for me to sit back and be counterproductive to her for 4 years would be ridiculous. It would be a reflection of my character more than a reflection of her character. You know what I mean? So yeah, so it's interesting. So yeah, thank you. I know it was in good hands. I appreciate that, and I think we all appreciate the neutrality that the people that were able to, with the commentators or facilitators or
Yeah,
whatever.
we always want, because the chamber is always going to be around. We're always going to do debates every 4 years. We just want to make sure that candidates can get their positions out.
Okay. Are you the president elect then?
I know.
Oh, you just swear you ain't got nothing to do.
So next year I'll be president.
You are not busy.
Yes.
This is good. Congratulations.
Thank you.
I heard that from someone, because I'm like, what's Shamari doing? Every time I turn on Shamari,
Somewhere.
Shamari. Well, it's true. You just know. Where are you going? And I talk about that all the time because you are one of those people that, I've seen you as a younger man kind of growing into this, and I'm glad you quit. I'm not. Knock on wood here. Because I'm still old enough, But yeah, to usher you guys through. Yeah, man, to hold it down, and kind of be, the next generation of leaders, and also knowing who's coming behind you. And I think it's awesome. I really think it should be that passing the baton thing is so important, you know. And I think that sometimes people have failed doing that in the, the last 20 years. And now it's like, let's take a different take on this. So next year you'll be the president, and yeah, so you're kind of getting in place right now. Woody is still the
No,
president.
no.
Who's president now?
So Mike is the actual president right now. So Woody is past president elect. Sorry,
Okay.
past president. And Mike Gibbs is the current president,
Okay.
and I'm the president.
Okay.
So Woody had the tough term of being the COVID president.
Right. That's why I still think he's the
So
president.
right as
Yeah.
he got in January, obviously by
Wow.
March. But I think just because Woody is such a great person and also such a great leader, that he was probably the best person positioned during that time
Yeah.
for everything the chamber would need to do outside of his job.
Right. Yeah.
He did an absolute fabulous job being
Another man who had nothing else to do with himself.
president of chamber during that tough time.
Who we fought
So
for.
we're going to be the recovered presidents, which we're happy to be as well.
But he's left it in good hands. You're
Oh,
right. He's an
definitely.
amazing person.
And he's still around because he still sits on our council. And then
You can find him
you can
anyway. Yeah, I tell you that. So definitely, welcome today. And going along with the preamble. Tiffany wasn't down with the preamble. She had no time for it.
She's like, here are the points.
She's
right?
very no nonsense like that, you know.
That's why we need Tiffany.
Yeah.
So when I'm going off on a tangent, she can be like,
It's
we are
fine.
here for this. That's good. I have things to do.
Yeah, I gotta get back to work. Okay, I gotta get home. Yeah, so thank you so much for just joining us this afternoon. Of course, today is Medical Monday, and we always bring something amazing from Health City on Mondays. Thank you all so much for sponsoring Medical Monday. And today we are talking about. Oh my goodness, I can't believe it. I thought it was longer, but apparently you guys are celebrating something. Tell us about
we are
that.
celebrating our 7th anniversary. So it's 7 years since we've been here in the
It's
Cayman
not
Islands.
longer.
Well, if you actually look at our track record, it looks like we've been here for 20 years because we've achieved so much in such a short period of time. However, that's due to the fact that we had a great visionary, obviously, in Dr. Shetty, who put together a great team here at Health City in the Cayman Islands. And every year, we've been pushing and pushing in order to just build upon what we already had. So just to give you an idea of the type of numbers that we've done, Catherine, from an outpatient perspective, up until December 2020, because we always count at the end of the year, we've seen more than 114,000 outpatients in our 7 years. Inpatients, 9,917 inpatients. Total procedures and surgeries, close to 9,910. And from a cardiac surgery and procedure perspective, 995, so almost 1,000. As well as from an ortho perspective, almost 2,000. So we have about 1,900 ortho surgeries as well. Just to give you an idea of the type of numbers that we're doing at Health City. And when we also look at, and you've been here for some of them, the firsts that we've had. A lot of these we had prior to you actually taking the helm, but for instance, artificial hearts. So when you need a heart transplant, however, there are so many hearts that can be harvested in order to get a transplant, as well as when you look at the US list, they don't even have enough hearts for their citizens. However, there is a little bit of a lottery that some people outside the country will get, but the chances of that are minimal for not only the Cayman but the entire Caribbean. There is LVAD, which is an artificial heart that you can have that will allow you to still be alive, right?
Wow.
So it's battery operated, and when you speak to a Dr. Benoit, who is obviously a cardiac surgeon, the LVAD is actually harder than the heart transplant.
Okay.
And we've done the first in the Caribbean as well as close to 10 throughout the Caribbean and the Cayman Islands to keep people alive as well.
Oh, wow.
We're the only ECMO center in the Caribbean, and this is the machine that takes your lungs and takes your heart off of your bodily functions, puts it on the machine so that we can either figure out what's wrong with you or keep you alive while the other portions of your body need to be healed.
Goodness gracious.
And that's one of the reasons why, if persons in a life-threatening situation get to Health City, we can put you on an ECMO machine and keep you alive while we figure it out, as well as why we're able to actually save you to then put you back on your bodily functions once you're better.
Yes.
In the US itself, there are limited amount of hospitals that would have ECMO, and we are lucky because here in the Cayman Islands we have 3 ECMO machines right at Health City, one portable as well, just to make sure. Back in the day, when we were having a lot of air transfers in and out, we also had the ECMO machine that we could put it on air ambulance, pick somebody up from Central America who otherwise would die. No one ECMO to bring them to us so that we can actually help to save them as well.
Oh, that's great. So, yeah, and that's basically how I think Health City was introduced to us as a country, right? Mm-hmm. It was with the whole treatment of the heart and all these major heart problem, and there's an institution that can actually deal with it. People could be brought in because it was a medical experiment, right? Because you were coming from the Department of Tourism. Right. So, and it's morphed into so much more. Mm-hmm. Yeah. Can you tell us a little bit about that? Like, that was always a part of the plan, I imagine?
Yeah, definitely. So, obviously, when a concept first comes, just like marketing, people will key on 1 or 2 areas just based on either what's most interesting to you or what through repetition has been stated over and over. Mm-hmm. The fact that we have a world-class island, or an island that is first world here in the Cayman Islands, think about the fact that most tertiary care, if somebody had an issue, you would need to fly overseas. You need to wait 14 hours for an air ambulance. So you know that time is muscle, time is heart, time is brain, that some serious, by waiting that long, your quality of life isn't going to be as good. In many instances, people wouldn't have made it, right? So the thought behind it was always that we were going to bring in life-saving surgeries that the population of the Cayman Islands would be able to actually take advantage of. Right. Now, outside of that, obviously, from an economic perspective as well, we wanted to make sure that we had medical tourism and bringing people from the US, from Canada, Caribbean, Latin America, because what we were doing was the first time this model had ever been done on this side of the world. Obviously, you learn certain things as you go. From a marketing perspective, there's always research. But when you look at healthcare, what was interesting to me coming from tourism, where there's so much data at your fingertips that we know exactly when household, the target of the household is over 100,000. We know that somebody who fit would be watching. Would be watching.
You can talk with words.
Yes. My mother, the English teacher. I used to say pencil at the age of 6.
I'm saying sandwich. When I'm saying, do you want a sandwich or one? Sandwich. Like, you get it right. Oh yeah, watching. Watching.
You know that we're watching at X time on Fox just because data. Healthcare so opaque in regards to the data that you can actually find in the US as well, right? Which was, so imagine in the Caribbean, that's usually more opaque on just general information itself. So there was a lot of learning that we had to have within that first year.
Right.
We found that we were reaching people, reach them, felt healthcare gap was needed across the Caribbean, Canada, US. That's why we even found out about, the cruise ships, for instance, right? They have islands of populations of people working for them. So a Carnival Cruise Lines can have 80,000 people that are working for them as crew members. They're self-insured, which means they pay for their employees' healthcare.
Right.
So the motive is quality healthcare, but also to reduce costs because the cost of service is over in the US.
Right.
So I say all that to say these are the different targets that we had. We closed last year for surgical cases in any given month between 35 and 45% of our surgeries were international. Right? And when you look at other facilities on this side of the world that are dealing with this medical tourism, they would have between, after being at it for 20 years, they would have the 10 option. Right now, first 5 years,
Wow.
just 5 years,
Wow.
just 5 years.
Yeah.
We were doing what other people.
Just as a community, we could tell that. You know what I mean? Like we didn't know the numbers and all the details you just gave us, but we could tell because Health City started to become household name within like the third year, second, third year on, where you get one Health City altogether. I'm like, they're seeing people. And so like I had a friend, this Marvel McLaughlin from East End, and let me tell you, she swore by Health City. Trust me, yeah. God bless her soul. She's an amazing lady, and she was just like, "Oh, I don't go anywhere else. If I have to go to town, it's because Health City just wasn't available that much, and they make space for me." And I love hearing that too with the senior citizens. They always felt very seen, and very heard and cared for, and I love that, because it's very important. So to become that trusted that quick. I think that is something else. Yeah. So, that's it. So tell me, how much staff do you have right now?
So we have 320 staff members, and of the 320 staff members, 30% are Caymanian.
Okay.
And of the non-medical positions, we oscillate between 75 and 85% Caymanian.
Oh wow.
So anybody in the hospital at the front desk, you will see the Caymanian staff. We have, when you look at areas such as housekeeping, security, transport, 100% Caymanian. And it will always be that way, right? And once again, that just it should be that way, right?
Right.
But outside of that, in all of the other areas, you will always find Caymanians there that we have, as I mentioned, between 75 and 85% Caymanian non-medical positions. And then over time, and we'll talk about healthcare explorers as well, but over time, obviously, give us another 5 years, decade, you will definitely see more and more of the Caymanians within the technical areas. We would have brought someone here already talking about how we're training, what we're doing with our young Caymanians, persons who would have started as porters, becoming, sterilization techs, persons who were answering phones, becoming phlebotomists. Once you have the right attitude and the work ethic, Health City will work with you, and we have pathways to make sure that you're going to be successful.
Yeah, well, the opportunities, as long as the opportunities are there, and the kind of facilitating of the training in those areas, because you do have the facility. So why not for the lab, the lab positions like you just mentioned, phlebotomy. I know in the U.S. some of these courses are 3 to 6 months, 8 months. You know what I mean? Like for the X-ray techs and all of that. Like these technical schools, I know for a fact in the U.S. They can be done within 6 months to a year. So I think those are opportunities. Those are things that you all do as well, and you're looking into.
Yeah. So we have, for those courses that you wouldn't need to go off and come back with a college degree.
Right.
We're working with our staff members to make sure that and even the phlebotomist it was an overseas course, but she would have been with us while we helped her that process. CSS Tech, we would have worked with to get certified while he was working with us. Currently, we have a young man who wants to be a nurse. So he came through our Health Explorers program. At first he was like, "Oh, nursing is for women," right? Right? But he, to his credit, came and saw and understood, and through our program, that said, you know what, I think I want to try nursing.
Absolutely.
And we are supporting him going to UCCI's nursing program, which one of in the second or third year, they also have a component where they come to House City as well.
Okay.
Right? So we work with UCCI in partnership on that. And sure enough, we're supporting him to go through and get his nursing degree. And then obviously, upon completion, we would love for him to come work with House City. But like we tell everybody, same thing when I was with the Department of Tourism, the mantra we believe in. At the end of the day, if we train people, but we're a young organization, meaning we had a lot of young managers, people may not see an immediate pathway.
Right.
If we train you to the point where you can leave and go get another great job, great.
Yeah.
And guess what? After you get that experience, after 3 or 4 or 5 years, you're going to come back.
Right.
We even in tourism, we saw that people leaving, getting experience, more experience, and coming back. And we're going to train as many Caymanians as possible. If there's an opportunity when they're here with us now, great. If not, and leave and go elsewhere, then that's great as well. The
Right.
country benefits,
Well,
right?
good. Yeah.
And that's what we care about when we're training Caymanians, whether it's on site or even our staff with it.
Yeah, and I think that's just a great attitude to have. The reason that I asked about some of those positions, and I think that Health City is in such a great position to do that, is because I'm finding that the culture of almost like further education has changed in the last 20 years, in the last 30 years, where the people like myself and, the 40-year-olds, they were going to go to college. They were going to do 4-year degrees. Like that was it. We just knew it was going to be like a long haul. Where you find like 20 years later, you find young people that they want to get to work quick. And because social media, because of everything that's so quick, it's so quick, you know what I mean? Like you can get almost 1,000 likes a day. So the time in 4 years meant so much. It's like, oh, I just want to go long. But these are a lot of different career opportunities that you can't get to, without that whole investment. And at some point, you can see, maybe it will benefit me to actually go further. But at least you're able to get something in your hand now. I just think it's a great opportunity for that. That's the reason that I mentioned that.
Definitely, and I think it's not only helps in that great position. I think every employer is in that
Absolutely.
great position
Absolutely.
that they should be looking towards giving back and helping to train, and whether or not it's within their own company but elsewhere. Because at the end of the day, that's the future of the Caymans.
Of course. Yeah. We're going to take a quick break, but we'll be back with more. We're talking with Health City today, Shamari Scott, who is the Chief Business Officer. And this is Medical Mondays on Straight Talk, the Drive to Five show. And it's brought to you by Health City. So we talked about their 7-year anniversary. 7 years. It has felt like 10 easy because so many things that have been done over that short period of time. And one more time I talked to Mari about some of the new things that are becoming up as well. Yeah, I'm excited. So stay tuned for more Straight Talk. We'll be right back. 370. More Straight Talk to come on Star 927. It's a ready for serving you is the friends and voters of
any type of cardiac incident, we had healthcare security in that you didn't have to go overseas in the torrential types of environments of COVID, and you're able to stay on island and get the services you needed. The one area that would be radiotherapy when it comes to cancer care in regards to radiation. But don't worry, within the next 10 months, we'll have the full suite of surgical, medical, and radiotherapy when it comes to oncology that will be here. And you would have heard through the announcement that this will be at and outside of that, we're going to have bone marrow transplant. Will be the first in the Caribbean. We'll have CAR T cell therapy, also the first in the Caribbean. We will have the highest level of neonatal unit that will be there, which means even in the Caribbean, they're called $1 million babies. We're going to be able to provide that same level of quality, if not better, but at a fraction of the price right there at that center, Kamanabe. And we'll also have state-of-the-art emergency center. There's so many people that we would have lost that weren't, as even though we're here in East End, that weren't able to reach East End, being right there in the center of town where 70% of the population actually lives and 90% of the population works. Georgetown, Seminole Peninsula will be able to reach all those persons in this new state-of-the-art facility that we will have there. And also, we opened a clinic in the BRAC. So many people have to fly over, wake up 4 o'clock in the morning, catch a flight, fight to get down to East End, have all your either your tests, your checkups, and then fight to get back down to catch a flight. Every week, we're carrying one specialist to the BRAC. This Saturday, we start with cardiologist Dr. Ravi, who's going to be going to see all of his patients as checkups, as follow-ups that were needed. So we're coming to you. So within your reach is our tagline for these different areas. And we're making sure that we are coming to the population, because what we heard is that you're so far, but we're making sure nobody can say we're far anymore, because we'll have certain level of services across 3 islands that are right within your reach.
That's great. I mean, who came up with all of this stuff?
It's a great team.
It's a great team.
Great team.
This is awesome. This really is. And so we can expect within 10 months to have something.
Yes.
And that's the, so you don't have to travel for radiation, right?
Correct. And we also worked out that with 70% of the population living in Georgetown and West End, 90% working in Georgetown and 7 Mile Beach, in just 1 year, based on our numbers, we'll save 3,203 car trips, which is 121,072 miles, which works out to approximately 288,000 minutes would be saved based on our location.
Wow. You've gone down, you've done the science on this whole thing.
Do.
Absolutely.
Yes.
That is so good. Congratulations.
Thank you.
You know, I don't know why 7 years. Why the celebration of 7 years? Is it something
we
celebrate
about
we
it? Celebrate every year. Every year. And we talk about what we've done, what we've achieved.
This is 7-year itch.
We're going.
That's why you're growing.
But this is 7 years. Last year, obviously, we were in a different situation. So just to see where we were last year, and where we are this year, it just shows you how lucky we are as a Cayman Islands to be where we are. And a huge thank you to everybody who listened, because there are other Caribbean countries that got the same instructions, but people, at times, still want to go fat, right? and go on in the most reason not wearing their masks. But we as a population are so disciplined that we listened and got great medical advice as well, and we're able to be in this situation. And praise to God that we're here and we're doing well. There's some people that are hurting based on tourism, but we'll whichever government, if it's one or another one gets in, I'm sure they'll follow the science and we'll open up safely when the time is right. And we're just in a better position than so many other countries, and we should be grateful. And we had great health services both throughout the Cayman Islands, not only Health City, that are here to be able to treat all of the persons who are here, and with our addition of radiotherapy and CAR-T therapy, as well as the neonatal unit, in the future, knock on wood, if there ever was an issue like we had again, nobody would ever need to leave Ireland.
Right.
Everything can be done right.
Right. Yeah. Yep. And I think it's right on time. It's right on time. It all lines up. Thank you so much for joining me this afternoon.
Thank you for having me, as always.
That was Shamari Scott. He is the Chief Business Officer at Health City. Today's Medical Mondays is brought to you by Health City. They are celebrating 7 years of greatness, of amazing stuff. You definitely want to check out the website, healthcitykaimanislands.com.
Or the shortcut.
Go ahead.
healthcity.ky.
healthcity.ky. I just Googled it and it just came right up. And it's a lovely website because it's so anything you click on it, there's like testimonials, there's lots of different just kind of categories, and you find out about the doctors you can read. So it's really a great place to go. So I hope people just go on there, see all that stuff, call you guys, make an appointment. Definitely. And looking forward to when you come on downtown.
info@healthcity.ky is the email, or call 640-4040 for your $500 gift. For your $500 executive health check.
Yes.
Most people have $500 in their wellness benefit. So come on down. We'll let you know what you have, and you can take advantage. And it's only for April, so you need to book now.
640-4040.
Yes.
Okay. And an actual person answers. Listen, when you choose that, trust. Listen, you want to get checked out, everybody. That is in your best interest, of course, because health is not valued until sickness comes. So take care of it before that happens. Thank you so much for joining me this afternoon. Listeners, we will be back tomorrow. Wednesday is the day, but tomorrow we're coming back. It's going to be some hot topics, and we will be chatting some more afternoon, and we'll talk to you then. Take care.
Is your number 349?
No, not. Well, yeah.